Hi everyone, welcome to Kinesiology 2030, and this is Lecture 9, Learning About Physical Fitness. This comes from Chapter 5 in our textbook, and the goal of this lecture is to really introduce how to design a training program or even just a general exercise program. Now, all these principles will be covered in far more detail in courses like Kinesiology 1120, which if you have taken before, this will be essentially a review for you. And then also in Kinesiology 3303, which will take these principles and look more at the advanced aspects of them. So, why I bring it into this course is a couple of reasons. One is not everyone in this course is a kinesiology student. They're taking this course as potentially elective, and I would like those students to understand how easy it is and how you can design your own exercise or training plan so you can improve your health, you can improve your fitness. And secondly, if you are in the kinesiology program going through kinesiology, hearing this multiple times and understanding the principles and getting it from different perspectives is extremely important. So, what we're going to be going to over today essentially is just prescription, how to write an exercise prescription. We'll look over the fundamental principles of physical fitness and exercise as well, and how really it improves our fitness, our exercise, and our health. Now, we've talked about adopting really a physical activity or a movement based lifestyle. And what this essentially is going to be talking about is just that exercise and that training aspect, and look at how we can help ourselves and help others by writing prescriptions for exercise. So the first thing we're going to talk about is really one of the most foundational pieces when it comes to training, and that's what's called the fit prescription or the fit principle. And what this is it's a real simplistic way of identifying the key aspects of training and what we need to put together when we're doing a training program. And so, what the FIT really is an acronym for frequency, intensity, time, and type. And it just gives us a way of putting together a program. So, looking at the frequency, how often should someone train or exercise, intensity, how hard an individual trains or exercise, and that's usually based on a couple things. We can use RPE scale, or we can use heart rate as our intensity. Time, we can essentially, obviously, is how long you're exercising for, and then type refers to the type of exercise. So, regardless of whether you go into a specific stream in kinesiology, if it's special populations or strength and conditioning or personal training or chronic disease prevention, this fit principle is what you're going to utilize when it comes to writing out that prescription for an individual. So, understanding this prescription is really the first and most important aspect. So, I have here four different types of programs or four different types of training goals. Really, the most common ones: cardiorespiratory endurance, muscular strength, muscular endurance, and flexibility, and how you would really apply frequency, intensity, time, and type to those. So if you look at cardiorespiratory endurance, a frequency, an example of that would be something like 3 to 5 times per week. Intensity would be something like 70 to 90% of maximal heart rate. Now, in order to understand what that refers to, is theoretically our max heart rate is 220 minus our age for males and 226 minus age for females. So you take that simplistic calculation and you gain your percentages by that. When you get into 3303, we'll look at far more advanced ways of prescribing intensity. But for basic fitness, basic health, that 70 to 90% of max heart rate is really all you need to utilize in terms of prescription. And when you go into gyms or you go onto a piece of fitness equipment like a treadmill, they'll right off the bat use max heart rate when they're identifying what intensity you're working at on that treadmill. Time for respiratory could be, I have 20 to 30 minutes here, but I mean, that could change based on several different factors, your fitness level, if you're training for something specifically. But for general health, general fitness, we look at 20 to 30 minutes of 70 to 90% being pretty general, pretty basic prescription. And then type would be any vigorous rhythmic continuous activity that can be done for 20 to 30 minutes at that 70 to 90% of max heart rate. Muscular strength, things like resistance training, or you can even do full body exercises, or you can do some of the play-based stuff that we're talking about, pull-ups, climbing, hanging. That could even be considered muscular strength. But usually frequency, we're looking at about 2 to 4 times per week. Intensity is based on 1 rep maximum in resistance training, so the greatest amount of weight you can lift once. So it could be anywhere from 60 to 100% in order to increase muscular strength. It has to be over 60%. And then reps and sets, again, is going to be based on several different factors. But generally, it's 1 to 3 sets at 3 to 6 reps. And weightlifting, full body exercises, calisthenics are examples of strength training or muscular strength training. Muscular endurance is a little bit different than strength. Strength is your ability to exert force. Muscular endurance is the repeated ability to contract your muscles without fatigue. So 2 to 4 times a week. Again, what we would look at for muscular endurance is being under 60% of 1 RM max, so it's much lighter. And then the reps are going to be far higher, and the sets are going to be greater too. So 2 to 6 sets and 10 to 15 reps. Weightlifting, full body exercises, yoga, Pilates would be the type involved with that prescription. And then flexibility or mobility, whichever you want to do or call it, is 4 to 7 times per week. Intensity is all about the point of tension. So it's about causing your muscle not pain, but being uncomfortable. And so how far you push your muscle will be based on the intensity. 10 to 60 second stretch is how long we want to hold the stretch for. And then anything like stretching, certain types of dances, yoga, mobility, Tai Chi, Pilates, gymnastics would be considered potential flexibility types of activity. So that's the fit prescription. Then the next thing you want to look at is how to design a workout. And there's really 3 components for every workout when we do it. And we want to make sure that when we are working out, we incorporate all 3 components in order to get an adequate workout, but also to make sure that we prepare our muscles properly, as well as help our muscles with recovery afterwards. So those 3 components of every workout are warm-up, and then your conditioning, your strength, your flexibility, whichever you're choosing to do. That's going to be your main activity. And then your cool down. So those are the 3 components, and each one is important. And I guarantee you that the majority of people probably skip 1 or 2 of these, and it's usually the warm up and the cool down. So how many of you go and do their exercise and just jump right into your main activity and don't really warm up, or take a very short period of time to warm up and then jump right into your main activity and then don't cool down? But all 3 have very important roles in our workout. So the warm up, this is really the main purpose of the warm up, is to prepare our body. Especially for the intensity that we're about to put our body through. If we're doing something like walking, playful type movements, warm up probably isn't necessary, but any type of exercise or training program, it's definitely going to be necessary, because we're going to be doing different intensities and we're going to be doing different types of activity that the muscles need to be prepared for. So whether it's exercise or sport, a warm-up is important because it does prepare your body for the intensity that you're about to put it through in the main activity. Typically, warm up should be minimal 5 minutes, max 15 minutes. Some people will do more than 15 minutes, but just in terms of time, we want to make sure that we get a good warm up in, and it doesn't have to be too long. So generally, I'm around 5 to 15 minutes, but I usually typically I'll do 5 minutes of a light cardiovascular work, like a walk on a treadmill or maybe some skipping, and then I'll do about another 5, sometimes 10 minutes of mobility work before I get to my main activity. And then what's happening is if we do it properly, which is slow, low intensity, gradually bringing our heart rate up. What happens is we get this nice gradual increase in heart rate, breathing, blood pressure, body temperature. It will then create lubrication of our joints. It also will help warm up the muscles and the tendons, and then that's going to help with the elasticity of our muscles and tendons. So we actually can decrease the risk of muscle tears or ligament tendon injuries if we warm up properly. And there's several different ways to warm up, but what we're starting to learn now is doing large body dynamic movements is really the most beneficial way to warm up. And the reason why we want to use large muscle dynamic movements is because the more muscles we recruit, the more heart rate will go up, breathing rate will go up, body temperature will increase, and then it's just going to warm our body up a lot easier. So we want to make sure we use our large muscles. So that's why like skipping or walking or a light jog is a good idea. And then dynamic movements are in the flexibility side of things. And an example of a dynamic warm up would be using mobility work, because you're taking your muscle through short stretches versus holding it for a long period of time, like flexibility. And what happens is when we do dynamic movements, we actually activate the muscle versus relax the muscle, which is what static does. And since we're warming up and trying to prepare for exercise, we want to make sure we are activated, not relaxing our muscles. Then we get into our main activity, which could be conditioning, it could be strength, it could be flexibility, it could be playing a sport, whatever it is. And so it's going to include any one of those following. It could be the cardiorespiratory endurance, it could be muscular strength, muscular endurance, it could be playing a sport. It's whatever you choose your main activity to be. And you do that for your extended period of time, whether it's 20 to 30 minutes or 45 to 60 minutes. It's what you are trying to accomplish within your goals of fitness and your goal within that specific training plan. Then once you're done your main activity, you're going to go to the cool down. Now, this is probably the step that most people cut out. They do not do the cool down. They go through their warm up, they go through their main activity, and then as soon as they're done, their run or their weight training, or they're finished playing their sport, whatever it is, it's pack up, get out, we're done. They never do cool down. It's something that it shouldn't be skipped. It's extremely important for your body, for your mind. And it really helps with recovery, because when we're in that main activity and the intensity is high, then what happens is our muscles break down, and stretching them out, relaxing them will actually help enhance recovery. So we want to make sure we do a proper cool down. And one of the main purposes is just to return mind and body to the resting state or the homeostatic state. A warm-up could be anywhere from 5 to 15 minutes. But what we should be trying to accomplish is first slowly reducing our heart rate. That way our heart rate won't go from, let's say we're in that 75% range in cardiorespiratory, right down to resting level. And what tends to happen is because when we're exercising that high intensity and our heart rate's moving a lot faster, we got a lot of blood flowing through the muscles to try to provide the muscles with the oxygen and the energy that's required for that movement. And so what happens is if we don't gradually bring our heart rate down, well, we're also not gradually bringing the blood flow down as well. And what could happen is we could have blood pooling in the muscles, and blood pooling will actually increase the risk of muscle soreness after exercise. And so that soreness that we feel, the delayed onset muscle soreness that we feel, actually will be intensified if we don't gradually bring our heart rate down. So it's important to make sure that we reduce our heart rate gradually, as well as our breathing rate, and that's going to help bring our blood pressure down to homeostatic level. Our body temperature will go down as well when we cool down, and it's just going to help really relax our mind, relax our muscles. Now, the main type of uh, workouts that we are going to focus on, and believe me, this is just a small part, but as I said, this is just sort of like a review slash introduction to this. So I don't really have the ability to go into great detail of all the different types of training that there is. And as I said, we have 1120 for that, as well as 3303, which goes into even further detail about the different types of training. But the ones we'll focus on are the cardiorespiratory endurance, muscular strength, muscular endurance, flexibility, because when it comes to health, those are really the four that you focus on. If you want to improve your fitness and you want to improve your health just at a healthy level, not a performance level, those four are really all you need to focus on. So when it comes to cardiorespiratory endurance, what this refers to is really the ability of our heart, lungs, and blood system to function effectively and efficiently. So when we work our cardiorespiratory system, we are decreasing our risk for cardiovascular disease because essentially we are stressing our heart, lungs, and blood system, and we're making it stronger, we're making it healthy, we're making it work better. And what happens is instead of blood and body becoming stagnant and stale and increasing the risk of triglycerides in the blood level in the bloods to potentially harden arteries, we're creating a blood flow of different variability that's going to make the body adapt to that. And that's going to improve our cardiovascular health, and it's going to substantially decrease the risk of cardiovascular disease. So cardiorespiratory endurance is important for that that disease of civilization that comes down to the diseases of the heart, and it should be incorporated. I truly believe that doing 3 to 5 times per week of cardiovascular endurance at varying intensity is going to decrease your risk of diseases of the heart, as well as diseases like diabetes and some cancers. So when we look at the frequency, 3 to 5 times per week is ideal. Intensity range, 70 to 90%. Max heart rate. Time, if you're doing 70 to 90%, 20 to 30 minutes is going to be sufficient in terms of health. If you want to exercise for longer, then usually the intensity drops, and that's fine. So if you're going to be going, say, 55 to 65% or 60 to 70%, you can probably increase that time to anywhere from 30 to 45 or potentially 45 to 60 minutes. But the key to note is if you are doing lower intensity, then you do need to increase the time in order to receive the benefits from that cardiorespiratory endurance. And as I said, with the type, it's any type of vigorous or continuous physical activity. So cardiorespiratory endurance could be running, it could be cycling, it could be swimming, it could be playing a sport, it could be doing an aerobics class. There's several different ways of doing cardiorespiratory endurance. What you need to do, though, is you need to find what works for you, what you enjoy, and what's going to keep your physical and mental health really increasing as you go through your cardiorespiratory endurance. Now, one thing we should note as well is we have that 3 to 5 times per week, but you also need to know that you have to be able to um, recover in between. So, sort of a general rule of thumb that I suggest is if you're going to do 5 days a week, um, make sure you have 18 to 24 hours between exercise sessions. That's kind of ideal for recovery and allowing your body, your muscles to recover and adapt to the stress that you've been putting on it. Um, Exercising 6 or 7 days per week, it increases your risk of overtraining. And to be honest, that's elite professional athlete level training. Um, elite athletes train 6, 7 days a week. There's no reason to do it if you're just looking to improve your health. If you're just looking to improve your health, 3 to 5 days a week is fine, as long as you are reducing your time sitting and you're being a natural mover as well during your week. Now, the intensity is calculated from your max heart rate, as I said, 220 minus your age uh, for men, 226 minus your age for women. And that gives you basically an estimate of what your max heart rate is, and then you can just calculate from there. So you can just say, okay, what's 70% of 220 minus your age? So you're 20 years old, so what's 70% of 200 beats per minute? And that gives you an idea of what you want your heart rate to be in. You can also use that RPE, all right, which essentially is just rate of perceived exertion. And that is just essentially you rating how hard you think you worked. There's limitations to that as well, but again, for health, basic health and basic fitness, RPE is a good scale, and you don't have to worry about the heart rate aspect of it. Personally, myself, I use heart rate. I find that is the best way to measure your intensity. And now with so many wearables in terms of fitness tracking being available, that it's not hard to measure your heart rate. The recommended amount of activity for health related cardiorespiratory physical fitness is 30 minutes. Just so you kind of know, that's what the recommended session would be, is 30 minutes. So if you're at 70% for 30 minutes, then you are hitting the recommended amount for improving health. So muscular muscular strength is increasing our muscle health. All right, so what we're trying to do is build strong muscles, but also doing muscular strength is going to increase bone density as well, because when you put resistance to your skeletal system, it adapts as well. And it's going to adapt by increasing the bone density and making your bones stronger and less resistant to fracture. So there are lots of benefits of having strong muscles. A couple that are included when it comes to health is it reduces your risk of low back problems. 80% of our population will experience some type of low back problem. But if you have strong muscles, you considerably decrease your risk in having lower back pain. And then it also will reduce the risk of injuring joints and muscles. So having strong muscles, having flexible muscles will decrease tears in the muscle, and it also will help provide strength and structure around your joints, and that will decrease the risk of joint injuries from both acute or chronic injuries. So frequency for muscular strength, 2 to 4 times per week. Intensity has to be greater than 60% one rep maximum. Time, you can do a couple things by time. You can go, okay, I'm going to do a 45-minute weight session, or you can just go whatever it takes, how long it takes to do 1 to 3 sets of 6 to 3 reps. So that's what we look at in terms of time with muscular strength. And then type, the best way to improve your strength definitely is weightlifting. But there's other things that you can do. As I said, calisthenics can improve strength, especially if you're doing things like pull-ups, climbing, hanging, push-ups. That will help increase strength as well. But the only thing is when you don't have external resistance, you do hit a point where you're just maintaining strength levels and you're not increasing strength levels. So that's important to note as well. So there's three types of contractions that we want to know in terms of what our muscles can do, especially when we're trying to develop strength. We have isometric contraction, a concentric contraction, and eccentric contraction. So what an isometric contraction is essentially it happens without movement. So if you do something like a wall sit and you sit on a wall in a seated position without a chair, and you just hold that position, that's isometric contractions. So your muscles are contracted and they're holding that contraction. A concentric contraction occurs when the muscle shortens. So if you look at a bicep curl, when you curl the weight, towards your shoulder, your bicep is concentrically contracting, and you can see it shortening. And then eccentric contractions actually occur when the muscle lengthens. So if we go back to our bicep curl example, when I take the weight away from my shoulder and my arm straightens up, my bicep is going through an eccentric contraction. Now, all three contractions can build strength. They can make your muscles stronger. So that's important to know, because a lot of people think just lifting weights up and down for a given period of time is going to build strength. But we can do other types of work as well. We can do isometric work. We can do just eccentric work, and that's going to build strength. Now, muscular endurance could be looked at a couple ways. Definitely can be done through weight training, but it does have substantial health benefits. Very similar to muscular strength, but it's just essentially it's a fatigue thing. Muscular strength, your muscles will fatigue quickly if you just build on strength. Muscular endurance will help your muscles not fatigue when they're going through repeated contractions. So in order to do that, our frequency has to be 2 to 4 times per week. Intensity has to be less than 60% of our 1RM, and our time or our sets and reps will be 2 to 6 sets at 10 to 15 reps. Typically, weight training, circuit training, boot camp type classes are what's going to increase our muscular endurance. And it has tremendous health benefits because muscular endurance, our intensity it's lower, which is going to allow us to do more reps. So muscular endurance is not only going to be working your muscles, it's actually going to increase the demand on your heart and lungs, so your cardiorespiratory system. So muscular endurance can improve not only your muscles endurance, but your cardiorespiratory endurance as well. So it's almost like a cardiorespiratory workout as well. So it's like essentially doing two types of workout in one. And the other one we look at is flexibility. Flexibility is defined as the range of motion around a joint or two series of joints. So when we look at flexibility, it is joint specific. There's two types or two ranges of motion. We have active and passive. So active is when we actively stretch our body, and passively is when we passively stretch our body. So an example of an active hamstring stretch would be if I lay on my back and I bring my hamstring up as high as I can. My leg as straight as I can, and I hold that position. That would be active. Passive would be if I take a resistance band and I pull my leg into that hamstring stretch position and hold it there with the resistance band. So it's essentially it is holding the stretch on your own power, or holding it with an external aspect to stretch. So the mobility work that we're doing, that's very active stretching, and that's why I like mobility over flexibility, because it is more active, and it takes your muscles through a little bit more of a specific range of motion. So the benefits of flexibility and mobility, I'm going to incorporate mobility in that as well. is it includes our physical performance because it allows for greater range of motion through the joint. It allows for better posture as well as reducing the risk of lower back pain. And it can have a positive impact on our mental health and also could be a great strategy for managing stress because flexibility actually will relax us. And the more relaxed we are, that's going to help our mental health state as well as managing our stress. That's why yoga is a very powerful tool in the mental health community because it stimulates so much muscle relaxation through the poses and the breathing that it relaxes the muscle and the mind. So, our flexibility fit principle or fit prescription is 4 to 7 days per week. Flexibility can be done every day because it's very low intensity, but helps with quality of life. The intensity, as I said, is the point of tension. So it's kind of an interesting one because um, flexibility is very similar to the old no pain, no gain. Um, if you're not making your muscles uncomfortable uh, in the stretch, you're not going to improve the stretch. So, what you want to do is find the difference between tension and pain. You don't want to stretch into pain, you want to stretch into discomfort. Ideally, we want to be able to hold our stretch for anywhere for 10 to 60 seconds. If we're trying to improve flexibility, if we want our flexibility to increase, we have to hold it for 60 seconds. And then we want to do 2 to 3 reps. And then the type is anything from basic stretching to yoga to Tai Chi to Pilates, some dances and gymnastics. Now, there are different types of flexibility exercises and stretching. So we have static stretching, dynamic stretching, ballistic stretching, and proprioceptive neuromuscular facilitation stretching. Static stretching is probably what most of us are used to, which is just the hold the stretch for a long period of time. All right, so that's the reason why it's called static, is because the muscle isn't really going through many contractions. You stretch it out to tension, you hold that position for 10 to 60 seconds, and then you let go of the stretch after. So that's static stretching. It's how we enhance relaxation in the muscle. So if we want that mental health managing stress, then static stretching is the way to do it. Dynamic stretching is more what we do with our mobility, where we take the muscle through a short stretch. We put it through its range of motion quickly, hold the stretch for only a few seconds, and then let go of the stretch. And we do that for multiple repetitions. And what that does is it gives us it activates our muscle. It gives us the ability to wake our nervous system up and wake the muscle up and wake the communication between the mind and the muscle. Ballistic stretching is bouncing. So what you would do is, in order to do a ballistic stretch, is you would get into a stretch position and then you would bounce the muscle back and forth. And that again is similar to like mobility. It's just activating. Ballistic stretching should only be done in people who have more advanced flexibility and more advanced muscular strength, because it could create problems if you don't have the proper muscular strength and flexibility structure. And PNF stretching, proprioceptive neuromuscular facilitation stretching, is one where we actually use contractions of the muscle to facilitate more relaxation. So we're actually utilizing the nervous system and some of the neurons in the muscle that cause relaxation to further the stretch. And if you take my 3303 class, we do an extensive lab on proprioceptive neuromuscular facilitation, and you actually will get to feel what that stretch feels like and how it improves flexibility. PNF stretching is going to be the type of stretching that improves flexibility the quickest. It shows within a few sessions a greater range of motion through the joint. Now, another aspect of health to think about, and one reason why we do different training programs, is to help with our body composition. So when we get into nutrition, we'll talk about weight management, we'll talk about body composition in more detail. But essentially, what we're looking at with body composition is just the percentage of fat-free versus fat-free weight, or percentage of fat versus fat-free weight. So the body composition looks at several different things. It looks at how much water, how much fat, how much muscle you have, and it gives you a percentage. So it gives you a total fat percentage. So if you do a body composition assessment, what you'll see is a percentage at the end of it, and it'll say something like 15%. And that just means that your body has 15% of fat. And why we need to know our body composition is because certain body composition percentages are going to increase the risk for certain diseases of civilization. So if we see high percentage of fat and poor body composition, we're just at an increased risk for diseases of the heart, cancer, diabetes, and other diseases of civilization. So it's important to make sure we're aware of our body composition. It's nothing that we should be constantly measuring, because that could lead to problems as well. It's something to be aware of, and just understanding and knowing what the healthy ranges are. And we'll go over those healthy ranges when we get into weight management. So some reliable means of measuring are skin fold measurements, bioelectrical impedance. Underwater weighing is the gold standard. The scales now, the bioelectrical impedance scales, are at the level now where they're fairly valid and reliable in terms of what their body composition is, especially for self-comparison. And that's really, when it comes to body composition, that's what we're most concerned about, especially with health, is just seeing if we improve ourselves, and that's what we want to focus on more than comparing ourselves to the norms. It's just, are we improving on our own? Now, when it comes to exercise and training, there's specific principles that follow. And these principles are important to know because these are the principles that really are the steadfast truths when it comes to training. These are the ones that have been around forever. These are the ones that are implemented in current research practices, and it's what helps us design effective plans and effective prescriptions. So why we need to know principles of exercise is really to help optimize our results. And there's these various principles or rules, and if we adhere to them, then they're going to really create successful prescriptions. And that's, as health advocates, health professionals, physiotherapists, strength and conditioning coaches, that's what we want, is we want success. And if we follow these principles, then essentially, first off, you follow these principles, then your prescription is not wrong, regardless of what it might look like. If you follow these basic principles, then it's not wrong because you are following the rules. And then secondly, it is what helps people. It helps people improve, and that's what we want. So these include specificity, recovery, detraining, pre-training, and overload. And overload, the principle of overload is really one of the key principles because essentially it states if you regularly overload the body, it will adapt and it will get better. And that's what we're trying to do with exercise, is we're trying to overload. right? So if you look at muscular strength, if you want to improve your bench press, then you have to lift a weight that is heavy to you. When you get to a certain part where that overload, your muscles are over to regularly, or your muscles are able to regularly overcome that overload, then your muscles have adapted to it, and that's no longer an overload to create stress that is going to stimulate adaptation. It is now going to be a weight that maintains your current state. So overload has to be consistent and it has to be progressive. So it means we have to make sure that we start at a certain load that is going to provide us with a challenge, but not hurt ourselves, and then progressively increase that load as our body adapts to it. Now, the other ones that we look at are things like specificity. Now, specificity refers to training or exercising the specific component of physical fitness we intend to improve. So, example, if we go with our cardio versus strength versus muscular endurance. If we want to improve our cardiovascular system, then we have to do exercises that stress the cardiovascular system. That's specificity. If we want to improve our strength, running isn't going to improve our strength. Weightlifting is going to improve our strength. So that is specificity. All right. So it refers to the type of exercise we do for our specific goal that we have in mind. We also use specificity in sports setting, which means if we are dealing with an athlete that is a hockey player, then we want to train the muscles that are involved in hockey. We want to train the cardiorespiratory system that is involved in hockey. So if we're working with a hockey player and we're trying to improve their cardiovascular function or their cardiorespiratory function, then we want to make sure that the times that they spend at a certain intensity is what we train at, right? We're not going to take a hockey player and get them to run a marathon and expect that to improve their specific conditioning. So specificity is important for health, for individual improving health, but also for an individual who's trying to improve their sport performance. Now, the other recovery that we want to talk about, or the other principle we want to talk about, is the principle of recovery. Now, recovery is very important because we need time to adapt to the stress that we put our body on. We need time for the muscles to heal before we stress it again. So what we want to make sure we do is, based on several different variables, have appropriate rest time. So the duration of rest is going to depend on several factors, like what component of physical fitness you're working at. Is it cardiorespiratory, endurance, muscular strength, muscular endurance, flexibility? What's the level of fitness of the person that you're training? Is it high? Is it low? Because someone with low fitness is going to need a little bit more time to recover versus someone who has high fitness. And then also intensity. Higher intensity activity is going to require greater recovery, especially in the health range of exercise. So there are some ways of looking at how to quantify recovery. And with the components that we've been looking at, cardiorespiratory endurance, 18 to 24 hours would be sufficient in terms of recovery between bouts of cardiorespiratory training. Muscular strength, ideally we want about 48 hours. Muscular endurance is 24 to 48 hours, and flexibility is 18 to 24 hours. So that's what we look at when it comes to the recovery time frame if you want to quantify when you can do certain training sessions. Now, the principle of detraining, this essentially is the use it or lose it principle, which means if we are not putting adapted stress onto our body will essentially revert back to how it was. So, for example, if I am improving my cardiorespiratory endurance and I'm going through a training program and I'm doing a big running program, and I'm running 4 days a week. One of the adaptations that's going to take place is there's going to be an increase in red blood cell count because I'm increasing the amount of oxygen demand, and my body is adapting to that increase of an oxygen demand by increasing red blood cell count. So I'm going to have this increase in red blood cell count that's going to continue if I continue stressing my cardiorespiratory system. If I all of a sudden stop exercising and I'm not putting that stress on, then my body is going to recognize that it doesn't need this abundance of red blood cells, and it's going to stop producing the extra red blood cells. So that's going to decrease my cardiovascular or my cardiorespiratory endurance because I'm not going to have as much oxygen as before. So detraining essentially is what we need to do is make sure that we maintain, we go through maintenance as we're going through specific times. So there's something called periodization, which we're not going to get into in this course, but 3303 we go into in great detail. And periodization essentially is a way to structure training programs so you can avoid overtraining and maximize results. And one of the things that it does is it allows for active recovery or recovery periods. And those recovery periods could be 1 week to 4 weeks to 6 weeks, depending on several factors. So during those active recovery, what you need to do is maintenance work so you don't lose all your adaptations. So if we look at cardiorespiratory endurance, in order to avoid detraining, we want the frequency to be around 2 to 3 days a week with at least 70% max heart rate and around at least 20 minutes. Muscular strength is 1 to 2 days. Usually around 60%. It could go greater. You just cut your reps down in that case and sets 1 to 3 sets, 2 to 6 reps. Muscular endurance 1 to 2 days a week. 60 less than 60%, 2 to 3 sets, 10 to 15 reps. So that stays relatively the same. It's just really dropping your frequency considerably. And flexibility 3 to 4 days a week. And everything else would be relatively the same. So when it comes to avoiding detraining and maintaining, what you want to essentially do is drop your volume by decreasing your frequency per week. Now, pre-training is an exercise plan prescribed for individuals with very low levels of physical fitness. So a much lower rate of, much lower rate. So it's a starting point. So pre-training is something that you would want to give someone who's just starting out. You don't want them to overdo it. So what you need to figure out is what kind of fitness level they're at and how you're going to help them succeed. And pre-training essentially is a great way of doing that. And usually the frequency would be something like 1 to 2 times per week. Intensity is going to be anywhere from 50 to 60%. Time is going to be anywhere from 10 to 20 minutes. The type of activity is going to be, what you would prescribe for someone who's training, but it's just going to be less frequency, less intensity, less time. And that will allow them to get adaptations and slowly build up some sort of strength or cardiorespiratory endurance. And it's going to help them feel successful versus being sore and tired all the time. And that's one reason why people quit, is because they don't want to be sore and tired, or they feel like they're failing because of that. Now, another thing to understand is obviously training for health is going to be considerably different than training for performance. Health and performance can be interrelated, but at the same time, they could be completely different. And understanding what performance-related components of physical fitness are important to note, because when we look at When we look at health-related components, it is going to be muscular strength, muscular endurance, flexibility, cardiorespiratory endurance, and body composition. But then when we get into this performance-related components, it's going to be power, agility, balance, coordination, reaction time, and speed. So these are all aspects that you need to make sure your health related components are at a certain level, and then you can start training these performance related components. Because if I don't have strength, I can't have power. If I don't have flexibility, I can't have agility and reaction time and speed, right? So all of them are interrelated, and strength is going to help with all of them. Cardiorespiratory endurance is going to help with all of them. Having an optimal body composition is going to help with all of them. And having adequate flexibility is going to help with all of them, as well as muscular endurance. So having good health related components is going to increase your ability to perform, because you're going to have a greater or easier time training things like agility, power, balance, coordination, reaction time, and speed. So if we look at what agility is the ability to change the direction of the body quickly and efficiently. So it involves a combination of balance, strength, speed, and coordination. And the sport-specific requirements for agility should be addressed regularly in both on and off-season training for athletes. Now, a lot of the times, we have very sport-specific agility work. If you're a soccer player, you're going to have to be able to change direction quickly from running forward to backwards or side to side. And so you want to train that. All right. But as an individual who's just looking for health, you may not have to be very agile, but it's still something that would be, potentially important in an emergency situation. So it's not like you need to go and do an agility training program, but that natural movement that we talked about in the movement lecture could potentially help with agility that you would need for health versus sport. A sport agility training program is something completely different. It's going to be more specific, and it's going to be something you need to regularly do. So when it comes to the FIT formula, the FIT prescription for agility, frequency, each training session, time, at each training session, your time should be spent on agility training. So it could be several different ways to do frequency. Agility usually something you do once to twice per week. And then intensity is going to be really sport specific. You need to do it at the level that you would perform your agility in your sport. Time, you can incorporate agility as part of your warm-up, part of your practice. There's definitely different ways to incorporate agility, but it's nothing, you're not going to do a 60-minute agility program. It's going to be a shorter time. And then type could be done several different ways. It could be done with agility ladders or playing tag games or anything like that. The next one we want to look at is balance. So balance refers to the ability to maintain equilibrium either while standing or in motion. And balance is going to require coordination of the muscles and the proprioceptive sensory functions. And there's two types of balance that we want to look at: static balance and dynamic balance. So static balance is balancing while not moving, and dynamic balance is balancing while moving. So most of us will do static balance, 1 foot balance, balance board work, where we're just stationary but working on balance. Dynamic balance is something that's going to be, very sport specific, and it's going to be important in agility, because sometimes in agility we have to be on 1 foot when we change directions, and so we're moving. So understanding those differences between balances is an important thing to note, especially when designing a training program. Coordination refers to the ability to control our body with or without movements, implements, or opponents and teammates. So coordination is really our ability to throw a ball, run without falling, walking upstairs without falling. So it's really our ability to have hand-eye coordination, foot-eye coordination, And it's something that is not only important for sports, but for health as well, because we need coordinated movements to help us not fall. And as we get older, that becomes important because a fall could lead to a fracture. Reaction time refers to the amount of time it takes to respond to a stimulus, and it's determined by several factors, including the number of stimuli to respond to, the various ways to respond, or the capacity or the ability to respond. So reaction time, again, is very important for performance, but for health and everyday life as well, it's important, right? Because we have to react to certain stimulus, and that stimulus could be while we're driving and someone in front of us slams on the brakes. We have to be able to react to that quickly and react appropriately to make sure we avoid putting ourselves in a dangerous situation. Same thing as if I'm stepping across a street on a crosswalk and someone goes through a red light. Being able to react to that, step back, and keep myself safe is important. So reaction time obviously is a very important sport parameter, but I can argue it's a very important health parameter as well. Speed is something that refers to the quickness of the body as a whole or a particular component. So speed essentially is just how fast we are. Speed relies on strength and power, so it relies on a health and performance related component. And it can, obviously, it's a very important performance indicator. I'm not so sure if it's an important health indicator. I mean, I guess there may be a time when we need to sprint away from something, but I don't know if we're going to go through a speed training program specifically to help us sprint away from somebody. But again, natural movements, play will help develop speed, and so will strength and flexibility. So the frequency for speed is a little bit more intensive than the other aspects. Balance, coordination, reaction time. You don't really need frequency, intensity, time, and type for that type of work. It could be incorporated again in warm up. It could be incorporated in main activity, in practice, whatever. You can incorporate those several different ways. You don't need to have a fit prescription for them. But speed you do, because especially if you're an athlete who needs a specific speed component, like a 100-meter sprinter obviously needs speed and is going to spend a lot of time in it. So frequency for speed is going to be anywhere from 2 to 4 times per week. The intensity is going to be great, 85 to 100%. So you're going to or close to your max speed. The time will depend on the event. If you're a 100-meter sprinter, then you're going to spend most of your time sprinting at that time. If you are a soccer player who might have to sprint for 15 seconds, a 15-second bout, then you're going to sprint at that time frame. And then type is obviously going to be specific to your event. What is it? What particular component of speed do you need to work on? And that's the type of activity you're going to do. Now, when it comes to training, whether it's for health or performance, overtraining is always something that is and can be a concern. Because if we're training too much, if we're not finding the balance of what our body needs and what's too much for our body, then we can overtrain. And what overtraining essentially is how fast we can recover from adapted stress. And if we're not overtrained, that recovery happens quick. If we are overtrained, then it actually is going to be considerably slower. So frequency when it comes to avoiding overtraining. Sorry, I have the same. I meant to go there. When it comes to overtraining, what we want to make sure we do is use our frequency, intensity, time, and type. Make sure that we are prescribing enough recovery in between bouts, and then watching for psychological, physiological signs. And those signs are things like depression, and that could include feelings of sadness and general apathy, chronic fatigue, changes in personality, and that could be emotional instability, as well as fear of competition. Decrease in self-esteem and motivation to work out, also giving up really easily, and difficulty concentrating at work, school, or during training. So they get very distracted easily. Those are some psychological signs that you are associated with overtraining. The physiological signs, the best one is heart rate variability or just resting heart rate. Now, heart rate variability is a little bit more complicated because you have to have a certain wearable technology in order to measure heart rate variability. So, what heart rate variability is it measures the variability between ventricular contractions. So it'll measure the time between ventricular contractions, and it will give you a score essentially of what's happening with those ventricular contractions. And if you have a certain score, you will be overtrained. If you have a score that's ideal, then you're good for training. But one of the most simple things to do is heart rate, because resting heart rate. Because if you see your resting heart rate spike up, that means your body's not recovering. It's not allowing itself to get to that homeostatic state of rest. And resting heart rate is a great fitness tracker because it can tell you if you're overtrained or not. Other things too that you need to look for is insomnia. Right, athletes will go through insomnia, or people go through insomnia when they're overtrained, and that's because they're elevated heart rate. Also, they'll have an increase in cortisol, the hormone cortisol, which is associated with overtraining as well, and that will enhance and increase insomnia. So if you see the signs of overtraining, both physiological and psychological, you need to dial back the training a little bit, let the person recover. Go back to the maintenance fit prescription. And when it comes to training and it comes to exercise, injuries is something that could happen and you need to be aware of. So there's several different types of injuries that we can suffer from. Contusions or bruising, when blood vessels are damaged, that's usually to a blow to a skin. So if we're playing a sport, we get body checked or we get hit by a ball, that can cause a contusion or bruise, and that hurts. And sometimes we need to avoid muscle contractions when we have that contusion. Most common is probably strains and sprains, and we do need to know the difference between the two. A strain is when we damage the muscle or the tendons. A sprain is when we damage the ligament. So strains can happen with both non-contact or contact, or could be created through acute or chronic injuries. But both are going to substantially hinder the ability to be physically active, and we need rest and recovery after. And then blisters, which are fluid of either water or blood that get built up in little air-filled bubbles from under the skin. We usually get them from wearing shoes. And it's from rubbing, and they again can be painful. A blister can change your gait, and it can completely affect what's happening with your muscles. So making sure that we have proper footwear, or wearing socks or adequate underclothes to make sure we avoid blisters. Now, if we do get an injury, there's a couple ways we can help reduce the problem with it. Now, injury management is very controversial right now, and pain management is very controversial right now, because a lot of people are battling with the old rice, or the ice aspect, versus a new way of dealing with injuries. And the old way is the rice, which is rest, immobilize, cold, and elevate. And so what this means is, obviously, if you get hurt, you need to rest. You need to reduce the risk of injury by resting and making sure that we don't hurt ourselves. Then the next thing we want to do is immobilize, which again will further reduce risk of injury. And also its goal is to help reduce swelling. And then cold will help relieve pain, so the icing. because it reduces any internal and external bleeding that's happening. And then elevate is the next one, which will also help reduce internal bleeding. So this is one of the older methods, and what we're finding now is immobilizing and avoiding the bleeding to an injury actually is hindering recovery, because what happens is when we ice or we elevate for too long, um, we decrease the amount of blood blood cells and hormones going to the site to help healing process. And there's a new way of reducing common injuries and enhancing how fast we heal. And it's a little hippy dippy, and it's called peace and love. And so what peace and love is it has two separate acronyms for first the inflammation phase and then for the repair and remodeling phase. So the peace aspect is initial first 72 hours of an injury. And this is more directed at tissue injuries like muscle strains and ligament sprains. And what you want to do is first protect the area, not so much immobilize it, but just protect it. Um, Make sure you're not using it. Make sure that you're avoiding contact in some way. So just protect the area. Elevation is good to a point. We don't want to elevate it too much. The old adage is above the heart, but just gradual elevation will allow for decreased bleeding, but still allow for the proper types of cells to get to the area for repair. Now we want to avoid anti-inflammatories. Before, one of the common things, if you went to a doctor and you had a muscle strain or a ligament sprain, they would tell you to take anti-inflammatories. Well, now what we're finding is anti-inflammatories actually hinder the healing process. So if we can avoid anti-inflammatories when we're hurt, in the initial phase, in that inflammation phase, that's actually going to benefit and enhance recovery. Compression, we still want to put a little bit of compression on the area, but not too tight. It's similar to the immobilize aspect. So we do want to wrap the injured area, but we don't want to wrap it for the entire day, for example. And then the next thing is educate. Educate yourself on what you can do to enhance recovery and make sure that you optimize your ability to get back. And then after the inflammation phase is over and we get into the repair and modeling phase, which is when we can actually start rehabilitating an injury. And the shorter the inflammation phase, the quicker we can start rehabilitation. So the first thing we want to do is load, which is load the injured area appropriately. So we want to find a load that's going to stress the area to help recover, to help the remodeling phase and start recovering and repairing the tissue. But we don't want that load to be too much. So that kind of goes back into the education side of things, right? So make sure you adequately load the area. You want to optimize healing, and you can optimize healing several different ways. You can use modalities such as TENS, which is the electrical stimulation. You can do certain types of stretching to certain type of massage. So you want to make sure you're doing everything to optimize the repair and remodeling. Vascularization essentially means you want at this point to start increasing blood flow. So using warm or hot as a strategy to increase the amount of blood flow that goes to the area. And then you want to exercise. So you want to make sure that you're not going to be falling into the principle of detraining by making sure you're doing some sort of exercise to stress your cardiorespiratory system. So if you have an ankle sprain, you can do battle ropes. You can do seated battle ropes in order to keep exercising. If you injured your arm, you can go on a bike. So you still want to exercise during the remodeling and repair phase, because that's going to help keep you maintained and keep your fitness maintained. All right. So that is really my introductory review of designing a physical activity training program. These are all the principles that really are the most important ones when it comes to designing. Everything else that you learn as 11, 20, 3303 is just far more advanced. And it's taking all these principles and implementing them into every single aspect of improving fitness. All right. If you have any questions on this, throw them on the discussion board or email me directly. Happy to answer them. Thanks a lot for getting on the discussion board already and putting questions in and comments. I love the questions. I love the comments on the discussion board. Keep that up. And we will talk to everybody real soon.